For those that can't see it, I was just doing a victory dance because we discussed in the huddle the concept of dancing in, and there were several naysayers that said healthy masculine cannot dance in. And Justin, always defining what the beautiful of masculine is, here you come dancing in.
You got to be comfortable in your skin, folks. That's just
Yes,
that.
sir. Yes, sir. Yes, sir. Yes, sir. And I love
And I'll
it.
tell you, I got to say, dancing can relieve a lot of stress, a lot of that nervous energy. So, which is perfect for the topic we're going to be talking about tonight.
That is very true. So welcome to our presenters, welcome to our audience on this eve of Thanksgiving in the US. We welcome you all, and we're here to talk about cortisol, the good, the bad, and the ugly, and all that is in between. So especially to our Americans out there, happy almost Thanksgiving. It's such a time to pause and reflect, and hopefully as well take a little bit of respite from things that might be stressing you in your life, or for perhaps, I know family is sometimes can be stressful conversations around those tables. So maybe today we'll be able to educate you as to what part of that stress reaction is and what we can do about it. So to those that are joining us, please do fill out the survey. We're going to kick off by talking about what cortisol is, why we care about it. And then after that, we're going to gauge who's in the audience to ensure that the balance of the webinar, what do you do about cortisol? Why do we care? We can be discussing that. So please do fill out that webinar. And separately, I'm seeing some frequent offenders here, namely those people that wonderfully always join us. Please let us know how you are. Happy Thanksgiving to you all. I'm seeing some happy Thanksgiving come in. So let us know how you guys are doing. Why don't we kick it off though with why we are all gathered here today? Cortisol. Who would like to take the first opening question as to what exactly it is and why do we care?
Well, I could always put my teacher hat on.
All right, Miss Teacher, let's hear it.
Let's dive into the nerdy scientific aspect of it, and then we can get to a little bit more of the practical. Okay, so cortisol, I'm sure most of you have heard of it, and it's like, okay, what is it really? I know it stresses me out. But really what it is, it's a steroid hormone. Yes, it is a hormone. And yes, there are tests out there that will measure it and that we are going to be talking about. But really, it is a hormone that is produced in the adrenal glands. And you're probably thinking, okay, I've heard of those. Where are they? They sit on top of your kidneys. All right. And they, kind of little tiny things, and they're sitting up there.
Oh, nuggets.
And it really, their main job, and they are primarily regulated. First of all, they're regulated through the HPA axis. That's the hypothalamic in the brain, pituitary also in the brain, and the adrenal axis. So HPA axis, and that's often referred to as that stress hormone due to its very important role in the body stress response. So it's usually released in a very rhythmic pattern. And actually, I know Justin is going to be talking about this in a more practical sense in the testing. And generally in this rhythmic pattern, levels generally peak earlier in the morning, gradually declining throughout the day. But really it's like, okay, so what is it supposed to do to me besides stressing me out? Well, it's got a lot of functions, okay? It helps with metabolism because it helps to regulate blood sugar levels. It actually stimulates what we call gluconeogenesis, which is that new glucose production in the liver. It helps to break down proteins and fats to provide that energy. Works in the immune response. It actually helps to suppress inflammation, modulates immune activity, or even prevent any type of overreaction. And I'm sure you're thinking to yourself, but wait a minute. Stress, immune system, isn't that usually causing more inflammation? Yes, but that's when it becomes more chronic. I remember we had talked about, I think it was like last week or 2 weeks ago, we were talking about the importance of particular hormones, things in our bodies that yes, there is like this sweet spot that they are doing their jobs the way they should be. But once we start moving outside of that beautiful homeostasis, that perfect area that it works so well, that's when we start getting into trouble. And that's cortisol is the same, in that stress response, that fight or flight. We want that. If there is, you know, say we're walking and all of a sudden, like we see a bear, say we're hiking in the woods and we see a bear, yeah, you better want to have your cortisol spike to be able to get ready to either, play dead, fight, scared, something to get your body ready to be aware. But you want it to get back to baseline. It is when our bodies don't recognize the difference of that fear, that thing that is putting us in that fight or flight state is not truly a threat, and it does stop. So that's where that tends to work. And we'll start working in a little bit more about what cortisol does, because other areas, it works for blood pressure regulation and electrolyte balance and in the circadian rhythm, which we'll get into a little bit more. So, it does a lot of things, and it's very, very important. So actually, I'm going to kick the ball to maybe Justin about, why cortisol is so important, as far as like maybe diving in or unpacking a little bit more of what I was talking about.
Yeah, so there's this tremendous ancestral mechanism at play when it comes to cortisol. Cortisol will save your life, to Dr. Laura's point, right? It's there for a reason. When your brain perceives stress, and I'm going to highlight that word perceives stress, because that'll be relative to 2024 cortisol versus primordial cortisol here. When your brain perceives stress, the cortisol will actually go to your liver and release glucose, blood sugar, so that you have some energy, right? Some fuel to get away from that predator. It's also got pain killing effects in case you get bit. It's got anti-inflammatory effects, like Dr. Laura said, because the binding globulin will take it to different inflamed tissues because you feel that stress, and you might get, maybe you got injured. You were running from a predator and you tripped and you hurt your ankle. The cortisol is doing a lot for you, and it's a very good thing. The other primary thing that cortisol does is it's this master regulator of circadian rhythm, right? Our ancestors, it's a very catabolic process surviving the day, right? You had to get up and you had to hunt and you had to gather and you had to make shelters. And it's a catabolic process. This process should take place during the day, right? We're not the type of species that does active things at night. We're supposed to wake up with the cortisol. That's why it peaks around 6 a.m. We do all of our catabolic work, and then it's supposed to suppress, and it's supposed to go down in the evening with this subsequent rising of the three most anabolic hormones so that we can restore and recover. Those being melatonin, growth hormone, and then testosterone. So it's this elegant thing that our bodies are just hardwired to do. We rise with the sun, and then we go down when the sun goes down. We work, we play, and then we go ahead and rest and recover. The problem is we've taken this acute hormone that is beautiful and useful, and we've turned it into a chronic hormone because we have all of these disruption factors now, right? We get home and we're supposed to be transitioning to the evening time. And what do? We go on our screens, we watch inflammatory news articles and different things, and it kicks on the cortisol mechanism again. If your cortisol goes up, now the melatonin can't go up along with it. It has to stay suppressed, right? So we've got all of these downstream effects, sleep issues and DHEA going down. We don't have as much sex hormones, and it's causing a lot of problems modern day because we've disrespected the ancestral mechanism.
Yeah, no, I think I like that both of you have really highlighted the duality of this, along with the duality, Dr. Varden, to your point, in the sense of most hormones have duality. We want them in a sweet spot. And the moment they're out of that, i.e., we don't have enough or we have too much, that's where it becomes problematic, because to Justin's point, we're this beautiful rhythm, this beautiful symphony that changes throughout the day. And we can always hear when an instrument is out of tune because it causes other sorts of disruption. So I know one of the more popular, and I wonder if we can pause here for a second, one of the more popular things that I see coming across my clinician desk when people seek me out as a doctor, they're like, my HPA axis is off. I don't make any cortisol. This is problematic. I wonder if we can unpack that, because I think people come in sincerely, and really what they're saying is, I'm exhausted and I'm stressed and things aren't working. And so I know it's because I've been stressed for a really long time. But I think what a lot of social media and other avenues have done them dirty is the sense of not properly explaining what they're trying to communicate. So can we talk a little bit about the HP axis and kind of this idea of adrenal fatigue? Because a lot of you guys see it all the time. People come to us and say, I'm not making cortisol, I have adrenal fatigue. What are they really trying to get at here? What are they a little bit misinformed about here?
Well, I mean, honestly, the adrenal fatigue diagnoses, it really, first of all, lacks robust scientific validation. I mean, as like a standalone medical diagnosis. And it's almost like a symptom where it's more a description of this cluster of non-specific symptoms that people have. If they're having, say, brain fog or fatigue or low energy, then they automatically jump, oh, adrenal fatigue. But the thing is that really it's such an oversimplification for such a complex regulation of the HPA axis. And, one of the major reasons why that, and I call it more of a theory, adrenal fatigue is flawed is because, as you were saying, Dr. Krista, the adrenal glands, they don't wear out from producing cortisol. I mean, even under chronic stress, they can still continue to function and secrete the hormones needed.
And we're qualifying this here, right? We're talking about people who have not been to a doctor and diagnosed with either Addison's or Cushing's. So let's qualify this conversation.
Right.
There are sincere medical conditions.
Yes.
You just straight up are making too much or not enough, or there's a lot going on. We're talking about people, though, who have kind of been through that gamut. It's demonstrated. They're doing A-okay. There's not a medical diagnosis. They're kind of fitting in this no man's land of kind of a syndrome, right? A stress syndrome. So that's what we're specifically talking about here, right? So people coming in, go ahead.
Right. And I did want to say, like you were saying, Cushing's and Addison's. Well, for example, Addison's is an adrenal insufficiency. And that usually occurs due to like autoimmune, issues. So, if some people are being like, well, what's that? Well, that's basically what that is. But yes, and thank you for that clarification, because we are so quick to jump to these, larger descriptors of, what's going on. But, chronic stress doesn't necessarily result in adrenal dysfunction, but it can dysregulate the HPA axis. And that dysregulation affects cortisol secretion patterns. It can like flatten it out or invert it, that diurnal cortisol rhythm, like what Justin was saying, where normally you want it to peak in the morning, start coming down at night, but it can actually flip-flop. And that's why people end up having insomnia. And, they can't get to sleep and in the morning, and then they're exhausted, or they just don't have that, the energy to do what they want to do. So although the symptoms can be attributed to the quote unquote adrenal fatigue, there's really, I think, a lack of possibly diagnostic criteria to standardize, those types of biomarkers. But either way, actually, I really would love to have Justin talk a little bit into this. And what he has seen, and also getting into some of the diagnostic criteria, ways of testing cortisol.
Yeah, so one of the funny things is that, Addison's and Cushing's, it's like, I think when people do that testing, and if a doctor has identified you don't have either of the above, that you're just normal and it's in the normal range, right? Doctors have a tendency to do that because that's just the tools that they have at their disposal. I think that when it comes to HPA axis, first of all, there's more than one, right? There's HPA thyroid, there's HPA gonad, there's quite a bit going on with the HPA. And the diagnoses of adrenal fatigue is a funny one because the symptomology can be really varied, right? Like there's so many things that it could manifest as, but very rarely is it the gland itself malfunctioning. And the adrenal gland itself is also very complicated. There's 3 different zonas in there. They do different things. So one of the things that there's kind of a cascade going on here is that when you perceive a stress, and modern day that could be eating the wrong food, right? You could take in a lectin or something and your body goes, oh, there's something toxic to that. Stress, or whatever it is, right? So we've got these stressors. It kicks on something called the reticular activating system, the RAS. That kicks
Fancy,
on.
sir.
I know, because I'm really super smart.
You are.
And that goes to a location in the brain called the locus coeruleus. Then that communicates with the HPA axis, right? So there's this big long cascade that goes on to ultimately land you with cortisol. That particular zone in the brain, the locus coeruleus, also releases norepinephrine, otherwise known as adrenaline, at the same time. So when this mechanism gets exhausted, the HPA axis can actually become fatigued in and of itself, for lack of a better word. Your brain can still release a lot of adrenaline when you feel stressed, but it's not being countered anymore by the cortisol, right? The cortisol is low, but the norepinephrine is still elevated. So it can cause further feelings of anxiety and stress and different things. And if you have chronically low cortisol and it's not due to an actual deficiency in the adrenal gland, that's a sign that you're at a later stage, perhaps with stress. Like maybe you've undergone just a brutal divorce or something like that, and you've been really stressed for a long time. You may have had chronically high cortisol for a period of time and then tested later, and now it's chronically low. Go to your doctor and he says, oh, good, you have low cortisol. But it's because there's a breakdown in the overall mechanism, and it can be a problematic phase. So be aware of that if it's chronically low.
Yeah, I think this really where, especially when working with a clinician to assess kind of in the murk that is anything stress related, having a really good history and a really good retelling of here's what happened and here within my body is what I felt becomes really important, because a lot of where the birth around the idea of adrenal fatigue and the idea of, oh, I don't make cortisol came from was work back in the 70s, 80s, 90s that really started to identify different stages of burnout and exhaustion in people secondary to stress, right? That was first identified. So just as we talk about like with the thyroid, if you have thyroid problems before you actually have a frank hypo or lack of thyroid function, you're going to see a seesaw. And so a similar thing will happen in some of this cortisol patterning. And so there's an element of the history that is taken is very, very important. So when working with your clinician, or when you think you're going through something that has to do with stress or a cortisol response, having a really good record of what happened can become really important in the diagnosis, because a lone marker of cortisol by itself may not be helpful by itself. Again, it's more that storytelling. Yeah. And Justin, I want to pick your brain a little bit here around cortisol testing and how can people go about truly assessing cortisol. But before we do that, I wonder if the powers that be, can you please put up our survey results? Because I want to make sure we're speaking to the audience that is here this evening. And I see you all growing. So welcome to those latecomers. I appreciate it. I'm late too. Please drop a hello in the chat as we're proceeding here. So the first question we asked everyone was, how familiar are you with the concept of cortisol and its role in the body? And so 72% of you said, kind of. I'm aware of it, maybe don't know the details. So I'd love to know in the chat, we just talked a lot about cortisol, how it might show up. Please pop into the chat if we were not clear about something, or if you have additional questions. We'd love to further that conversation for you. The next question we asked was, do you experience any of the symptoms, right? That wide gray area of syndrome, meaning it could be absolutely everything and nothing all at once. What do you experience or attribute to high cortisol? And it was almost an equal distribution across all the options, but really weight gain, sleep disturbance, and anxiety being chief amongst them, as well as fatigue. Let's not toss that out there. Fatigue tends to be pretty persistent. The last question that we asked everyone is, have you explored or tried strategies to manage your stress, or more namely lower your cortisol? And about 35% of our audience, Hala, you guys have tried to actively manage it, with the balance saying, I'm trying or I'm not, because there's a little bit of a struggle here. And so we'll make sure, I think, as we, especially more at the close of this webinar, we're really addressing ideas of tangible takeaways for different sorts of people, right? I think, and I would imagine, Dr. Lara, I think in your practice, Justin, in your practice, we can all agree that, when it comes to stress reduction or directly addressing this, right? Every person is different. And even knowing the three of us, if one of us was struggling with cortisol, the to do about it, how do you address it for each of us, would be so very different, so individualized, because we all have different genes and we all have different experiences within the world. So it's definitely not a one size fit all of like, go become a Buddhist monk in the mountains and meditate it away. All right, so back to the task at hand. Justin, do you want to talk a little bit around testing? How do people, I guess, typically, what's the foregone thought of like, hey, I'm going to get a blood test? Is that helpful? And if not, what else might be helpful?
I think that one of the main things to remember with this is that we're not really trying to quantify just the totality of the cortisol. It's not so much about volume as it is about rhythm and patterns, as Dr. Laura said. It's going to be high at one point in the day and it's going to be low at another point in the day. And that's absolutely fine. There's also a difference between blood versus spit. I'm more of a fan of a saliva test because some people are scared of needles. You know what I mean? Let's be honest. If you're one of these people that has the anxiety surrounding blood draws and you get that to see what your actual stress hormone marker is, guess what it's going to do, right? Also, an at-home test versus driving to a lab, because let's say you have to get up early to take your morning measurement and you drive to the lab and someone cuts you off and there you are at a red light swearing back and forth with somebody, and then you get your cortisol tested 10 minutes later. Dr. K knows all about that. Your cortisol is going to be way up, right? And so there's an acute response that happens with cortisol that we need to be aware of. So I favor doing it in a little bit more of a calm and structured environment. Typically, if you're going to get it done, you would take 4 different measurements throughout the day, right? So you would do an AM measurement, preferably around 6, 7, when it's supposed to spike. If that one's low, that's an indicator of lots of stuff, right? That's when you want the higher measurement there. You take another one afternoon. Remember, it should be on its way down, that decline. Then you take another one, noon, afternoon, and then night, kind of evening and then night. And then they'll usually take a sum, right? So they'll add it up and they'll see what the totality actually is. But again, that's not the most important part. It's the rhythmicity of it. What's it doing? What's it look like? Now, medications, caffeine use, what time of day are you working out? There's a lot of things that can impact what that rhythm looks like. So I recommend doing it a few times, right, to see the average. What's it really doing? The other issue with cortisol testing in general is that it's based on this population thing. So they could test the monk living in the mountains, and that's incorporated into their data. Then they could also test the ER, the person who works in the ER, and the meth addict that they're actually reviving. They'll test that person's cortisol too. And all of it gets incorporated into this data. And what we end up with is this huge, big spectrum that's all considered normal, right? So if you test within that spectrum, which is way too big, in my opinion, you're still considered normal. And you could be really low in the morning and really high in the evening, but still in the normal ranges. It doesn't give you a good, accurate measurement, in my view. I would rather compress those measurements a little bit. And just remember what that rhythm is supposed to look like. So if it's higher in the AM, lower in the PM, you're probably doing okay. If it's chronically high, you may be in an acute phase where you just have a deadline at work and it's still elevated all day long, or medications or what have you. But pay attention to the rhythm and then do it the right way. I recommend saliva. Try to do an at-home test if you can as well, to not skew the numbers.
Yeah. Yeah. Now I wonder if, thank you for that, Justin. I really appreciate that. In particular, that the word you use, rhythmicity, I'm going to use that moving forward. But I think really the emphasis and the idea that it's not one time. It's not only going to be across the course of a day, but to our point before, history taking of, you want several tests because one day won't show it all. I wonder if at some point I want to start talking to different genes and how different people might be a little bit more sensitive to stress and therefore, should be a bit more vigilant around this idea of cortisol imbalance, right? But before that, I wonder, maybe Dr. Varden, if you can start us off, I wonder if we can explore a little bit. So your cortisol is off and it's been off for a while. To maybe, in Justin's example, you've been through a divorce, which is harrowing on heart and schedule and body and all the things, right? So you've gone through this long stress, right? Let's talk about the different tolls that can take on the body. And I'll qualify this by saying this is not a diagnostic checklist of you must have all of the above. There's an element of cortisol exhaustion, cortisol dysregulation will show up differently. So we're going to kind of talk to different areas that it will impact. Dr. Varden, any preferences to which area, knowing there's so many little apples to pick from here?
Yes, there is. If we are talking about, well, let me put it this way. If
Yeah.
I had a patient sitting in front of me, a client sitting in front of me, and totally stressed out, and actually I've had several of them, it's trying to find out, first of all, what's going on, telling their story, because a lot of times people bottle up the frustrations, the stresses, and there can be many in many different forms, fashions, and ways. Okay. And this isn't just a, psychological, mental. There can also be physical stresses in different ways. Say that person is over exercising. Okay. Not allowing their bodies the time for recovery. And then throw on top of that deadlines at work, or, travel. They're doing a lot of traveling. They are getting ready for the holidays or having the financial, things. A lot of times being able to almost word vomit their story, just decompress, take that little pressure valve and just start allowing it to let off, some of that steam, helps to kind of calm things down some. And then we can really start working on what is the most impactful thing? Where do we really need to start? And, when we're talking, I had mentioned earlier about all the different areas that what cortisol affects, affects the metabolism, the immune system, your basic stress response, blood sugar, electrolyte balance, circadian rhythm, all of these different things. But really, it's getting down to the root cause of what is it that is causing such a massive chronic response. Because there can be, your phone making notification chimes and people are just like throwing their phone, and it's like, okay, that is not the root cause of that stress. That is a trigger. That is what is, poking that bear that's already pissed off. So it's finding out what is it basically that has pissed them off that is really problematic. And actually I was noticing in the chat how Faye said healing traumas, stress, beliefs, emotions, you know, all of those things. Those are the underlying causes. Those are the underlying issues that really ultimately need to be addressed for everything else downstream to start balancing out.
Yeah.
So,
Yeah.
you know, when you can start working on some of that, then you can also start giving techniques, breathing techniques, vagal tone, activation exercises, or even vagus nerve stimulation devices, something to start calming that nervous system that can really help reset
Yeah.
that nervous system.
Yeah. Yeah. And I think to your point, it's so very important to have a practitioner that you can communicate with properly and are able to explore kind of the root cause and explore addressing it, right? Because I think, as we're going to articulate, cortisol impacts so many different systems within the body, right? It will dysregulate so many different systems. And so having a practitioner that's not only willing to work with that system, but ultimately, to your point, get back to root cause so that can be adjusted, that's some pretty big work, right? And so feeling comfortable with the practitioner, just like I said, probably all three of us would have different techniques to reduce cortisol, right? All three of us probably might need different personalities or different supports within our practitioners to get to a point where we can address root cause. Yeah.
I
Yeah.
think that a really important point here as well is that like your brain does not know the difference between a real threat and a perceived threat.
Mm-hmm.
And that's really when it comes to like ruminating thoughts and different things, it's really
Yeah.
that reticular activating system will get kicked on the exact same way based on you reliving an argument you had in third
Yeah.
grade. And I should have said that to the guy, right? That's the same thing as if an actual predator literally jumped out of the woods and went after you.
Well, it's just kind of like when people try to connect the dots with, like, why does high sugar food, independent of the impact on my body, why does high sugar food bother me, right? And that's because it will raise your blood sugars and then they will crash, and your body is not aware, like your body does not have the cognitive ability to be like, cool, blood sugar here, that's why I feel off. All it knows is there was a drop, and the body experiences that as stress. And that's what then you then feel that as stress or anxiety. And so I think, Justin, you're making a really, really beautiful point in that, a mechanism that used to be so helpful, identifying a bear, okay, cool, we got to deal with the bear, which now can, to your point, be brought about by a memory of grade 3, or maybe I finally indulged and had that delicious sugary thing, and now my body's like, yo, what'd you do to me? Right? That's important. So what though are the physical impacts of chronically dysregulated cortisol? So for our person who's been through that divorce, it's been a year in the making, they're exhausted. What are the impacts to health that they should be mindful of that maybe will bring them to the doctor's office, or that we ideally want them to go to the doctor's office now versus, when they're actually problematic? How does cortisol impact our day-to-day health outside of feelings of stress and exhaustion and fatigue?
I'll start. I think that like the sleep mechanism is usually one of the first things that gets compromised by that. I think that's really common, especially when we have that weird pattern going on where cortisol is being raised in the evening. As soon as that sleep gets compromised, there's a really bad downstream effect because, as I mentioned earlier in the call, the rising of growth hormone melatonin, melatonin is a really potent antioxidant. Between the hours of 10 p.m. and 2 a.m., you may have heard people say that that's a really important time to be asleep. Usually, melatonin takes about 12 hours to reset, right? So, if you get out of bed at like 6 a.m. or 7 a.m., that same time PM is when the melatonin system is resetting. And our brains go into a certain depth and we get that deep sleep, quote unquote. And that's where the pituitary gland will pulse growth hormone, right? So we've got all of these beautiful restorative mechanisms in place. And as soon as that cortisol is dysregulated, we're not getting that theta brainwave. We're not getting that detoxification that's supposed to happen. And we're not getting the restoration from things like growth hormone. So I think sleep is one of the first things to go. What would you add to that, Dr. Varden?
Oh, well, okay. So if we're throwing in, say, some physical symptoms, all right, we've mentioned this weight gain. especially around the abdomen. You'll see that, like that tire that starts to, be more present. High blood pressure, high blood sugar levels, even weakened immune system or a weakened immune response, even that can lead to more frequent infections, getting sick more often. You had mentioned about sleep disturbances. I know I had mentioned about insomnia, especially when you have that pattern flip-flop. Okay. Also, it can actually start looking into even increased bone loss, especially because the nutrient deficiencies or malabsorption, not getting that, especially over a much longer period of time, and this is definitely more in the chronic realm, that it can affect, the integrity of the bones. Thinking more into mental. So increased anxiety, irritability, depression. Actually, I saw in the chat, I think it was Julia had mentioned, she's saying 7 p.m. every night, she can't handle being spoken to. She's like, done. I'm just done. She doesn't have the patience anymore by that time. And I mean, so that, it's looking at going, okay, so you are hitting a point of that irritability, that anxiety, and so your depletion, that's the time period. So these are the kinds of things that can come up. Also working into like that poor memory, difficulty concentrating. And this is where like the brain fog comes in. But definitely working more into those long-term risks. So like I had mentioned about, bone loss, integrity, over a long period of time, this is going to show up in increased risk of cardiovascular disease, type 2 diabetes, that HPA axis dysregulation. Your body is screaming at you. You need to start listening. It's asking for change, because if you are in this state or any of these states that we have talked about, then what you're currently doing is not working. So this is where you need to stop and start listening to your body and start making some changes. And it's not saying that I'm not wanting to put, like a slap on the wrist. It's not that. We all go through it. I've gone through it too. You have to give yourself that space of forgiveness, going, okay, I've been taking this good care of you. Now it's time, and it's okay.
Yeah. And I think it's always to really good ends, because I think some of the things I didn't hear mentioned, right, is everyone wants to live well and live long, right? And stress is a cause of cancer. And I don't say that in an inflammatory way. I'm meaning to like create fear. That's how I mean inflammatory there, right? It's just something that wears away at the body's ability to take care of itself, right? When we talk about longevity too, we talk about the wear and tear on DNA, right? And the wear and tear just simply of the body to be able to exist. And this is where it ties into. So I like the idea not only of stress and some of this stress regulation being a signal of maybe something needs to change, right? But this change being something that ultimately seeds better health and better joie de vivre, right? What's the point in, dancing with your body if you're not enjoying the dance?
Yeah, and it's the yin and the yang, right? Because it's like I think our body really strives for balance in so many ways. I mean, I'm gonna get that word homeostasis tattooed on my forehead because I seem to say it every single webinar, but it's because it
You should
applies to
go
every
post it.
topic. Wouldn't that be beautiful? The yin and the yang, right? I mean, we talk about cortisol as being the daytime catabolic hormone. The day is a catabolic time. It's the time where we got to get off our asses and get things accomplished. Then nighttime is anabolic, right? So we've got that yang energy during the day. That's what it's for. And then we've got the yin. The Chinese made the yin and the yang 2000 plus years ago for a reason. I believe it
doesn't, I
translates
think.
to anabolic and catabolic activity in the body,
Yeah.
sympathetic, parasympathetic. The body has this need for homeostasis. And I think that the real breakdown happens when we've got out of that for too long and we become cortisol dominant, we become way too sympathetic in our life, and then we just don't find that time to restore. So I think that a lot of disease really stems from that loss of homeostasis over the timeline.
Yeah. 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 No, I love that. So I wonder if we could gently transition before we take some of the questions that people have been offering us. I wonder if we gently transition to, you know, what are ways, what are considerations people can make when they're trying to reduce cortisol? And let's be very specific insofar as, you know, if you're someone who is, who really experiences rest through movement, or if you're someone who really experiences rest through quiet, or if you're someone, let's offer different strategies for different sorts of people. Because again, I hate when people are like, oh, you're stressed, you should meditate, as if that's a cure all for everyone. So maybe, let's go around and offer different strategies for different effectively personality sorts. I think we haven't done a huge service to the genes, right? Genes really can support. So feel free to toss in some genes here as you're speaking to some of the stress supports. There we go. We're close. But what are ways that you guys suggest or offer to your clients, to your patients, to reduce some of that cortisol in a long-term meaningful way, or maybe even in the moment, right? You see that proverbial bear, which is really just a thought in your head. What are ways that you can calm down in the moment?
Can I start on this one, Dr. Laura? Because
Absolutely.
just so you don't steal what I'm about to say, uh, because
Lara's got an arsenal. It's good. She has so
yeah, no,
many.
Laura will be fine, I'm sure. So Dr. Laura and I actually interviewed one of our friends, Dr. Patrick Porter, on one of these webinars, and I will not forget one of the things that he said.
Mm,
He talked about how many thoughts we have in the day. I think he said we have 80,000 thoughts per day, and
it's an
almost all of
underestimate.
them are negative, right?
Hmm.
It's a really crazy thing. And negative doesn't have to be that guy's a jerk off. It can be just generally, like it can be negative in general, right? It can be thinking about finances, it can be thinking about the state of the world, politics, whatever. But almost all of our thoughts at a baseline are negative. And what he said was if you view things as challenges instead of threats, right? Like if you can just frame it in that way, you've got a way better outlook and you're actually talking yourself into things. I'm reminded of Michael Jordan before he would take a shot. He would tell himself and he would visualize it going into the basket, right? He would actually actively say, "This is about to go in, brain. This is what's about to happen," and he would take the shot. Lo and behold, it would go in. So the convincing of yourself, almost self hypnosis about positive dialogue throughout the day, I think that really pulls the goalpost back on you so you can score a little bit easier when it comes to cortisol regulation.
Yeah,
I think
yeah,
it's way worse when we think negatively about our circumstances. So just remember that. Look at it as a challenge, not a threat, and things will
yeah,
start to transform for you.
yeah. And to offer a little bit of neurocognitive computer behind that, right? The idea is that we as humans, we can't take in all the stimulation around us. And even if we could, right, we're still having to conceptualize it, right? You see something before you, if I'm looking at my hand, I am thinking hand instead of being like, okay, I see this blob with these colors, right? We identify things. And so when you start to work towards the end of a positive framework, right, to the end of let me have that, you prime the way you see things, you prime the way. So you have really two options truly, and this is a muscle, right? This isn't something you wake up and decide this is what's going to happen. This is a muscle you exercise like all the other muscles, right? By adopting more of a positive or challenge forward network, right? You exercise the muscle of the way I perceive this thing before me is going to be more positive, and that will naturally then not lend to that more fearful, threat based neural cascade, right? This is the mechanism where thoughts quite literally impact biology. It's a little bit more complex, but I really want people in this webinar to hear, to Justin's point, to what Dr. Lara is going to offer in a little bit. This is an exercise and a practice And if you think that you can think your way into it insofar as tomorrow you're like, I'm only going to think positive, you're setting yourself up to an extent for failure, because it's a muscle you have to exercise. When I go to the gym once a month and I'm like, I'm going to do it more. But that first time that I walk into the gym and I lift my weights, the next day hurts a lot. And that's because I'm not exercised. But if I keep going back and I keep moving those muscles, it hurts less and it becomes more natural and it becomes an automatic thing because you've exercised your muscle in that way. So I really, if people are going to work towards this positive mindset, keep that in mind. It's a muscle and you don't get to give up. The important part is getting back up when you inevitably have a slip up because you're exercising a new muscle.
And speaking of exercising and using a new muscle, I have several clients, and me personally as well, I do fall into this. When I get stressed, anxious, whatever, I clean. It's like, I'm stressed out if my house is spotless, or if I have company coming over. But it's really, when you're talking about cortisol, you're talking about this, glucose release. Remember, I had mentioned gluconeogenesis in the beginning. That glucose has to go somewhere. Muscle is a great glucose sink. Use it. With meditation, I can't seem to shut off my little monkey brain. And, I constantly have to, rein it back in. I actually find it more relaxing doing walking meditations. I go for a walk. I go on a hike, being outdoors, having, that Shinrin Yoku, the forest bathing, okay, getting so many different benefits, the grounding, exercising outside. I love being barefoot outside in the grass, or, and doing some yoga and stretches and really working my muscles. I know my daughter loves to run. She loves to go to the gym. That's where she gets her frustrations and everything else out. So doing something physical, can be very helpful for people. Yeah. Something in the moment, say you are, this is coming up, in a store waiting to check out. Okay, Christmas time, everybody, the queue is like around the corner and you're waiting and you've got places to be and things to do and lots of presents that you're having to purchase. And we tend to get a little bit more irritated. And so something that can help is the realignment of the nervous system of the two hemispheres of the brain by, putting your hands out, thumbs down, left hand over right, lacing your fingers, bringing it up and just resting your hand on your chest. And, you can stand there and you may look a little strange, but so what? But in that, it helps to reorganize the nerves and the systems of the brain. And as long as you don't fall over, you can actually put your left foot over your right, the ankle, and stand there. I've done that before. Like I said, I look a little weird, but I really don't care. So it
beautiful
works.
thing. Yeah.
Even doing some tapping, some EFT, again, if you are somewhere, that you can't, take a moment, close the eyes, do some breathing exercises, or you don't have your brain tap, handy, or, you don't have a heart math device handy or whatever, you can just do some tapping. There are certain spots like on the hand that you can tap, or even, on the face, on the head. Again, it may look a little strange to some people, but if it's helping you, who cares? Let it help you. Yeah. Again, there are so many different things that can be done in the moment, but that can also be done to help have that relaxation. But this is where that personalization comes in. as we practitioners get to know the client sitting in front of us, knowing their stories, knowing, what they like, what they don't like, looking at their, genetic profiles and how they process information, finding those techniques and also things that they have done in the past that have worked.
Yeah.
Let's revisit that. So think back for those audience members, when you get stressed, when you do that, think back to a time that things were joyful, that you were calm, okay? Or that you were a little bit stressed, you did something and it helped. Put your mindset in that joyful place. Think of that. Amazing, the biometrics that change, the brain rhythms, your heart rhythm, everything, just thinking of that joyful time, okay? But then starting to implement some of the techniques that have worked for you in the past.
Yeah.
You know a lot more than you think you do.
I love that. I love that. I think just to the end where we have data that demonstrates a negative thought can increase cortisol, right? The same power is true on the positive side. There is brain imaging evidence that positive thoughts can shift the biophysiology of the body. And that's really to that end of shifting perspective, and then separate to that, really having extra that the more positive thoughts, even if it is just dropping into your mental safe space, right, that can shift the biochemistry of the body. I've seen within the chat, I really appreciate Jihan, I'm not sure if I'm saying that correctly, but I appreciate within the chat, scattered amongst the, oh, I exercise, or, oh, I listen to music, or I do this and that. I really value that there's the honesty of, when I'm stressed out, I eat, and I'm totally part of this club. Food is my best friend. But I would offer, but that spurred a thought within me. So before we transition to questions and answers, I do want to take a moment to speak to some of the females, or in particular people who have periods in our audience. And I'll make a comment for myself, right? My stress coping techniques change through the course of my cycle. The first half of my cycle, if I'm stressed, I need much more of a physical outlet. So I need the gym, or I need walks, or I need to go punch something, right? There's a physical outlet for that first portion of my cycle. Whereas the second, I need something a little bit more gentle, right? And part of that gentleness is definitely food. I think we can't throw baby out with the bathwater. Proper food is a stress management technique. And so I say this to the end of not focusing exclusively on those people who are menstruating, but more to the end of, your stress technique may not be consistent either throughout the month or separate to that throughout the course of your life, right? Justin, you can speak so beautifully to the male experience, namely that I would imagine stress techniques that worked for you when you were 20 are not necessarily the stress techniques that you're using now, nor, if you have a 50-year-old man in front of you, are those the stress techniques you're suggesting for them. So I really encourage people to be continually curious around this, because for me, over the course of a month, mine changes. For the course of a woman, from when you're menstruating to not, that's going to change. And then for a man, especially decade over decade, that's going to change. And this is that individualization of our medicine and of work with your practitioner that's so very important. And it's okay if you thought once upon a time it worked and it no longer does. Just means you different, just means time passed and your body's doing what your body's doing.
Yeah, and we also, the tendency for males would be that default aggressive thing. And I like a lot of what we're saying as far as this capacity to, like, if you can't think your way into positive action, then you can act your way into positive thinking. I really think that emotions are energy in motion, and sometimes we have to get out of our head and get into our body. The problem is that you can get into a state where you just overtrain as well. And as for males, as we age, you can't just do that, right? Like, you're going to have an impact on testosterone and things. So what I recommend is there's this concept of working in versus working out. A gentleman named Paul Chek talks about this, who I'm a big fan of. And you're getting into your body either way, but sometimes you need to add in some more restorative stuff. And I think guys have a weird thing where we don't want to do that. If we're going to work out, we want it to be a bombastic grinding session, and slamming weights and slamming punching bags and doing that whole thing. And that's great. And we need that as well so that we don't murder stuff. But I think that it's okay to also go for a walk if you're a guy. It's okay to do a
Won't be a-
stretching, a mobility session if you're a guy.
Yeah.
So don't be afraid to work in. You can work in and you can work out. And as a 20-year-old versus a 60-year-old, you're going to have to transition a little bit more towards that working in phase, and that's okay too.
Yeah, and blasting some music and dancing.
Yes.
Yes. Yes. I like that answer. Yes. All right. On that beautiful note, I want to start transitioning over to our questions and answers. So the first question here, and I'm glad we have Dr. Varden in the audience or in participation here. So Jessica is asking where you guys at with DNAU. So we were and Dr. Varden, please, as our dean of students, please ensure you keep, you're going to hold me honest. We have been doing a lot of work to update some of our courseware. And so that is now all online. There's been a few hiccups. Part of the upload of that was a little bit disrupted because the West Coast from BC to California was experiencing some internet outages secondary to a crazy windstorm last week. So there's a few images that aren't there yet, but by and large, everything's up and running. And if you have other questions, Jessica, about getting started within DNAU, please make sure, do it private. You don't have to share it with everyone. Just shoot us your email so that we can be in touch and further support you. I know our most magnanimous, the end of the day, my tongue isn't working anymore. Magnanimous Dr. Varden would love to support all your DNAU needs. Yeah.
Yeah, and I actually have office hours, or if you need some question and answers one-on-one, I am available. So yes.
Yeah. All right. So Julie is asking a question that's I would say slightly off topic insofar as Julie, I think will probably redirect you to a few of our webinars, but we will give it a little bit of a perspective from the viewpoint of stress, right? Because everything you're detailing in your question is definitely speaking to things that can cause stress, or stress will be implicated within. So Julia is officially in menopause this year. Congratulations. Welcome. Her weight has increased dramatically and she doesn't feel great. She doesn't sleep. She has a very busy life and emotional trauma throughout the years as well. So kind of a multifactorial way of getting here. She feels like she's really aged. She's saying, in the past 2 years, probably feels like she's aged 20 years. How does she get out of the bad sleep cycle and get yourself on the path to healing? So first and foremost, I think there's a lot to be said around some of the hormonal changes that you've gone through, how that needs to be assessed and properly supported. And when I say hormone, sex steroid, right? So I think first and foremost, going to a practitioner who's well versed in those hormones, who knows how to appropriately test them, and very importantly, can give you the options, right? Be that natural, i.e. through diet and supplements, or a little bit more aggressive, i.e. through BHRT. I think working with someone, it can be Dr. Varden, it can be someone here within the company. I think that's really important. But I wonder if we can speak a little bit to the stress of that, because everything that she's just detailed, right? I have a past that primes me towards stress. The past year, this transition, it's not always easy for women. For a lot of women, it's not necessarily a welcome change, right? Any thoughts around just kind of the sleep and the stress management there? Because that sounds to be a very understandably a pain point. Yeah. Oh, Justin, you're on mute. I think you're trying. Or Dr. Varden, did you have any thoughts there?
Sorry about that. My computer froze for a second there. I didn't hear the latter half of what you said. Dr. Varden, if you would like to take that question, please do.
Okay. Yeah, really, I mean, for that, because I've been there too. I mean, I've just gone through entering menopause. There are definitely some low-hanging fruit that can be done to clear those muddy waters, to make things a little bit easier. So that way, for ideas or possible treatments that you may consider if you want to venture down the bioidentical hormone therapy treatment, or if you want to look at supplementation first, or doing some other definitely lifestyle changes. there are things that can be done. There are definitely ways to help with that transition, to help with the, higher weight gain, higher stress. But the specifics in which to do that, I would definitely say is very much personalized, and it's something that I would want to, be able to speak with you, be able to work with you to see what are those easier changes of things. And I do want to say this for everyone, that it may seem overwhelming. Cortisol, stress, all of this stuff. It's just like, oh my gosh, every time I turn around, it's like it affects everything and it's from everywhere. And where do you start? And blah, blah, blah. And then all of a sudden it's like, okay, kind of like what my mom has said. And I've always said, it's like, how do you eat an elephant? One bite at a time. You just start somewhere. And it can seem like this overwhelming aspect. And again, it's looking at your life, at your genetics, at your situation, taking you as an individual and saying, okay, let's start right here. Let's change this one thing, because you want to start changing, first of all, something that you are going to change. Don't try to change something that seems so magnanimous, that it's so amorphic, that it's just like, it's not going to get done. That's not going to do anything. You need to do something that is tangible, that is workable, and that you can manage. Because like, I don't remember who exactly said in the chat, when you are stressed out, even the most simplest things, a task, can seem overwhelming. This is what we want to try to avoid, is more overwhelm. So we need to be kind to you, be kind to yourself, and make little shifts that can start making little differences. And when you make more and more little differences, then all of a sudden you're making big differences and you start to have real changes.
I love that you said that, because I can very much empathize with the idea of trying to boil the ocean. I think I personally tried to fully capture with my brain the problem, then think out every permutation and then try to do it with my brain, and that doesn't always work. I was having a conversation with a doc this weekend, and we were talking about how we treat for people who feel overwhelmed, because it's a very difficult client to work with, because their experience is, I don't even know where to start. It feels like too much, even if you're just asking me to wake up every day. And the idea there really is, you're kind of committing, like in your mind already committing to a year of work, but with awareness that it's going to feel so tiny and gradual, because the work at first is going to be nothing more than a tiny thing of waking up every day. That's where you start, and it's okay. And just focusing on that makes it feel a lot better. There's a lot of like meditation parables, right? Where the person comes to the master and says, hey, I want to meditate. How do I do it? And the person's like, cool, go meditate for 5 seconds and come back to me in a month. Right. And that's where you start, right? You start with 5 seconds, because 5 seconds will then build to 10, which then builds and builds and builds, but in a way that doesn't feel like work.
I think the way that you, sorry, Dr. Varden, I was going to say, I think the way you frame it in your mind is going to matter a lot with that as well. Like we talked about, right? Viewing things not so much as a threat, but more so as a challenge. And appropriately enough, because we've got Thanksgiving on the way, I do think that finding some level of gratitude in yourself really helps to kind of kickstart that as well. You can't feel gratitude and anxiety at the same time. So oftentimes when my life is just a full-on disaster, I look for those little things, even all the way down to the air in my lungs. It could be down to that. I am grateful today for the air in my lungs, and just start there. You know what I mean? Because you can build from there. This is a momentum game. You got to really slowly build it. And unfortunately, it's easy to lose momentum and hard to build it. So just start where it starts and let the process go.
Yeah. And like I was saying, I tried to boil the ocean a few times. Didn't work so well.
Yeah. But you learn from that, right? I'm sure everyone in the webinar right now is being like, darn it, I boiled an ocean too. And it didn't work out for me. I hope, Julia, that was helpful. And again, I really I know we kind of sidestepped the main cause, the root cause, as Dr. Varden is so beautifully focused on. But I really would encourage you to engage with a practitioner who's very well versed in various hormone things, because I think recovering from the experience of burnout to an extent has to start within body, and a little bit of hormone regulation, I think would serve as the platform to support and kick off that work, right? That's the cup of the ocean. I think that's probably something you want to evaluate with a clinician. Is that the appropriate first cup to boil?
Yeah, sometimes we do have to use some Band-Aids, to just stop the hemorrhaging so we have a chance to figure out the root cause, just to kind of help out, just so, you've got the energy to be able to figure it out.
Yeah.
That's okay.
Yep. Modern day medical problems require modern day medical solutions. We can't get around that. Yeah. All right. Evelyn has a question for us. And so I'll take Evelyn's question. Evelyn is saying she's been diagnosed with secondary adrenal insufficiency. So when we were talking about, has a doctor told you it's actually adrenal issues? This is Evelyn, and it's caused by an ongoing need for steroids. So this is secondary to another medical condition and the treatment thereof. Treatment in the UK is just to increase part of her medicine that is causing the problem. Are there alternatives or other things that can be done to help? I'm just going to say, I apologize, Evelyn, this isn't going to really be the answer that you want. I really encourage you. Yes, there are other things, but what those things are really dependent truly on that medical history. And I need to ready you for, it's probably going to be a combination of things. And so I think you finding a practitioner that's well-versed on both sides will be helpful, because without knowing anything, my suspicion is it's probably going to be a combination of both. But I would encourage you, you can reach out to us if you want, or we can maybe refer you to an integrative practitioner within the UK. We do have a footprint there of people who know our genes and work in that space. But I think this needs to be evaluated more, because me saying yes or no isn't a good answer. But my spidey sense tells me there's probably something in between, some medication and then some alternative support as well. All right. The next question that we have here, this is very much around viewpoint again. It's from Alyssa. She's saying, can we do something about our perception mentality and doing inner work that acts as a master control switch? I think we've spoken to this, but I'll continue through the question. Using meditation, self-healing practices to find calmness within the out of control world. And how do we do this when our world requires us to earn money, run the rat race, kind of do all the other things that are starkly opposed to all the kind of very monk-like practices that are encouraged? How do we break the system to say, no, my health is much more important than all the other things, but in the same turn, still keep food on the table? I have an answer, but Dr. Varden, Justin, I'd love to hear if you guys have thoughts as well.
Yeah, this is where Justin waxes poetic about the hero's journey and these kind of things.
Oh, let's hear it, sir.
So things happen to people, but people happen to things, right? You can be the type of person that happens to things, and that makes you a creator and someone who actually steers the boat, in your life. The concept of the hero's journey, of course, being that, you have control over yourself and you do not have control over anything outside of yourself. I always use that video game analogy, right? Where I say that I look at my life like I'm the main character in a video game, and the plot and the narrative just happens around this avatar that I have control over. But no matter how crazy the plot gets, I control this main character. So I just go zoop and I bring it right back to Justin's energy, thoughts, and actions. And that's what I can control. A more practical answer would be things like time management, the ability to troubleshoot. These are learned skills as far as still getting your stuff done and paying Uncle Sam, as you said in the question. I recommend really just trying to isolate some level of time to get in little micro workouts, something that you can do to really take care of yourself and still accomplish X, Y, Z. It's a time management thing, but also just be a little bit forgiving and understand that you only have control over you. And yes, it is difficult to actually take care of yourself in this realm, but go out and happen to things, because things are going to happen to you. I guarantee it.
I love that. Dr. Varden, any thoughts?
I would say be kind to yourself. And also, in being kind to yourself, realize that you are important. Don't be so quick to give away your time and energy to others. Have strong boundaries. That is really helpful. And it's also leaning in on family, on those you trust, because you've got to have an outlet to be able to bounce ideas off of, to be able to just sometimes just to vent, just to go, just don't give me advice, don't do, just let me vent. And that can actually clear out some of the frustrations and clutter, so you can start thinking more clearly, but also allowing others to help you, being accepting of that, because we are not an island, and moving forward into changing your reality into what you truly enjoy, where your passion is. That'll happen. And it's getting creative in the way that you do that. But again, allow others to help you, and stop trying to carry the world on your shoulders by yourself.
Yeah.
But Dr. Krista, I want to hear what you have to say.
Yeah. I have two thoughts. I think when I bring people into my practice and I work with them clinically, right, it's usually a health concern that they come in for, be that a mental health or a physical health concern. And one of my questions within my intake is always, what do you care about? Why do you want to be healthy? And really, I'm asking to the end of, what are your priorities, right? Because there's I think this is very true. Anything within the world is possible, but not everything. And what I mean to say is, your priorities really direct what that anything that is possible is going to be, because you can't do everything. And I think in particular for women, there is an element of that prioritization has, through our socialization, been stripped away from us, because we are told you must take care of everyone, and then maybe if you have anything left over, take care of yourself. And so there's an element, some women, right, that's a priority for them. That community, that mothering role is what is most important to them. So you focus health strategies around that, but that's not necessarily everyone's goal or every woman's goal. And so I think there's two challenges when we hear a question like this. First of all, what's important to you? I'm surprised at how many people haven't really sat down and said, this is what my priorities, this is why I want to be healthy. But I think separate to that, really dissecting, why is that true for me? Is that because society has told me that, right? To Dr. Varden's point, in the grocery store, I shouldn't be putting one foot in front of the other because people are going to look at me funny. Is that something the world has told me I shouldn't look funny? And is that something I'm okay with, right? Or is that something maybe I challenge and I get out of my skin and change a little bit? So I think that answer is so going to be individualized. And I think the health care and the health support really can mirror that. I have friends who have decided financial success is important, and I'm willing to sacrifice my body for that. Just like I have friends who really espouse the Audre Lordes of the world, who have said, no, rest is important to me, and I will sacrifice the other side of that. Right. And neither one is wrong, neither one is right. It's just aligned to what's important to them. So I always, for questions like that, and I encourage, what's important to you and what are you willing to sacrifice for? Because you can't have everything, but you can have anything. Yep.
I love that.
All right. Let us continue on. All right. Deborah is asking, How can a person who has experienced chronic pain from an untreated injury or unhealed scar deal with prolonged cycling of flight or flight, high sensitivity trauma response, and can anticipating pain without actual pain trouble? Oh, mon Dieu, girl, yes. so, so the question is effectively, she's experienced chronic pain from a treatment, or sorry, from an injury, right? So there's an experience of chronic pain, and what can often develop from that, right? Just the way we can exercise muscles to kind of think positively or negatively, and muscle is sometimes exercised within those who have chronic pain to anticipate pain, and there's almost an element of that anticipation is almost as painful as the pain itself, or more problematic than the pain itself. And so she's asking, I guess, is this real? Yes. And then separately, what can be done about it? I'm seeing Justin nod here. Justin, any thoughts, or Dr. Varden?
Yeah, how to approach it, right? Because it's like there's the practical side of things that you can use for pain management. You could utilize PEMF therapy, red light therapy, things that will hopefully help accelerate the healing process itself. Then there's the psychological side of the incident itself that also kind of sticks with you, right? So there's the psychological things that we could address. I think it makes a lot of sense that if every little movement you make causes some level of discomfort, that absolutely it's going to hit that RAS, right? The reticular activating system is going to perceive that there's something wrong. And there you go. You've got this elevated cortisol. I would recommend for starters, really setting up a nice parasympathetic bout every day that you can do, right? Like I have this whole thing that I do where I biohack a nap effectively, and I do a brain tap on a PEMF mat with a GABA disc thing on my wrist, and I've also
Don't
got this
delight
on the
me.
other wrist, my Apollo Neuro. So you can get as nerdy as you choose to with it, but I think finding a time that you can actually on purpose activate the parasympathetic nervous system and really get that healing response kind of elevated is a great place to go with that. When it's really bad, you're going to also want to pay attention to the breath, right? You're going to want parasympathetic breath because your heart rate is going to keep on elevating just when you're in pain. So I would say that, get a little breath work session and try to find some of these restorative biohacking tools. Take a 45-minute break midday to just give your body that restorative capacity. Ladies, do you have anything to add to that? I'm sure there's so many ways we could attack this one.
Oh, absolutely. And it's really understanding, that fear pain circuitry, because this really gets into the brain's amygdala and prefrontal cortex, because they work to have that anticipation and prepare for any potential pain. And especially when the pain is chronic, I've been there, did that for many years. That circuitry becomes sensitized. It results in that exaggeration response, even to non-painful stimuli, like you were talking about. So there's nothing wrong with you. It is not your fault, but you have to break that cycle. You have to work on rewiring, doing the types of ththings like what Justin was saying. And this can be a combination of physical, mental, emotional approaches, in the perception, doing things, if you can work with a really good hypnotherapist, but then like on your own, even techniques of vagal nerve stimulation, like Justin was just saying, the Apollo Neuro. I had mentioned this earlier about vagal nerve stimulation devices. So Apollo Neuro being one of them, Sensate. There's the Hulist, V-Relief. There are several different ones. And then things that we've also mentioned, like the brain tap, doing these more of the neurofeedback, the heart math, the breathing, where you can actually see how you're breathing, how you can get into heart coherence, and calming that down. Also using somatic techniques, yoga, Tai Chi, also with the emotional freedom technique, the tapping, doing any, cognitive behavioral therapy, CBT. This really helps to reframe any negative thought patterns around pain, reducing those anticipatory stress responses. And there's also other psychology and other processes like there's pain reprocessing therapy. It helps to retrain the brain to interpret pain signals differently. Like I said, there's a lot of different things. Oh, I remember you talking about scar tissue. Okay. For scar tissue mobilization, there's something called, it's a frequency FSM, frequency stimulating something or other. Anyway, what it does is it helps to massage and break up the scar tissue, kind of like a scar tissue mobilization. But there's also other techniques: massage, myofascial release, acupuncture, also different types of physical therapy, trigger point therapy. A lot of those different things can actually help with that scar tissue, because that actually acts as an energetic block, scars and things like that. So you want to work with someone who knows how to work through that.
Yeah, I think finding a really good integrative practitioner that is able to see with their hands, right? Assess the site and then suggest appropriate measures and work with you based on the response to such will be really important. Finding someone that can see with their hands is so very important to these ends, because Dr. Varden just listed 35 gajillion options. Lots of options.
Basically
The question
telling
is,
you
what is
there are
appropriate?
things that can help.
Yeah. All right. So next question here, Jihan, my honest person who acknowledged eating. Thank you. They say that their daughter, 21, has mental disability and OCD. Hormones are out of balance. And from a testing perspective, they come back differently every time. The only thing that is always high is cortisol, though she doesn't look stressed and she's always on her phone. Could that be a hidden stressor? We're not able really to speak. It sounds like there's a lot of things going on, and I would really, really encourage you to get your daughter to a practitioner who, especially over the course of a month, can assess for all these different fluctuating hormones. There's things like the Dutch test complete, right, that can fully see into different hormonal changes, and I think that's going to be important. But separate to that, can the phone be it? I think Justin kind of indirectly answered this at the beginning of the webinar, right? When you're sending your brain different signals as to, during that catabolic or daytime, or sorry, during the anabolic nighttime, right, where you should be resting, but if you're sending it daytime signals, that messes things up. And is that part of it? Sure. Is that root cause? Maybe not. One of my more clinical indicators of late, the past few years at least, of anxiety, depression are people who get lost in their phone more to the end of avoidance, right? So this could be more a byproduct and a coping mechanism than necessarily the cause. So I think it's really important for your daughter to see someone, because at 21 things can change so beautifully and so quickly, and it's better they change now than 40 years from now. Yeah. All right. Julia's offering into the ether everything that we feel. This is exactly how I feel: overstimulated. Girl, I'm with you there. I think especially for people who have ADGER2 deletions, right? You don't deal with the noradrenaline. Feeling overstimulated can happen easily. And so I don't know what the question per se, other than expression of this, other than maybe really carving out downtime for you, namely downtime where your nervous system doesn't have to process sensory information. I find that can be a beautiful stress technique for people who, with that ADRA deletion, that's a gene that we're talking about that helps deal with stress if you're very sensitive to it. Being in a space where you're not overly stimulated is very, very helpful. Yeah. All right. Diane. Okay. She falls asleep in about 5 minutes, but wakes up after about 5 hours and can't get back to sleep. This has been happening for quite a while now, for a fair portion of the year. Before that, she was pretty good. Oh, she has a sick cat and a husband, and she's the caretaker for both. How can she get better sleep? She's saying that she's exhausted. I'm gonna quickly speak to this, and maybe Justin, Lara, if you wanna chime in afterwards. Diane, it sounds like you're a caregiver, and it sounds like of consequence to that, your own health is going off the rails, statistically, from a statistics perspective, or at least from a medical perspective, right? Being a caregiver is an element of your health. Namely, it is a detriment to your health. That is not to say you should not be a caregiver. It is to say you need some very specific strategies to support yourself, because when science has followed caregivers, right, we see that they have worse health outcomes. So we want to be very aggressively is too much of a word, but we want to be mindful, and we want to be addressing and supporting you properly. So I would say really engaging with a practitioner who's very well versed in social determinants of health and social strategies in particular, possibly within your area, who can say, hey, you can engage with this service that can help you with the care of your cat and of your partner. I think that's going to be really important, as well as, maybe with us, where we can say, here's your stress response, here's how you experience the world, and here's some strategies specific to your genes. But really work with someone who understands what it means to be a caregiver and understands the health consequences of that. Because I don't want to dismiss your sleep problem, right? It's probably a byproduct, I think, of the dysregulated cortisol, but we want to be very specific and strategic as to that caregiver support, because that's a very difficult variable to work with clinically, because at no point in time is anyone going to say, don't care for your cat and don't care for your partner. Yeah. Team, any other thoughts there?
Yeah, I'll chime in on that just because I'm also a caregiver, so I completely and utterly understand the taxation that can take place with that. And I will say that if you do choose to enroll in one of our programs, I'm more than happy to be your practitioner, because I'm sure we'll vibe on a few of these things. With regard to the sleep disruption and what I think could be happening there, as well as, remember at the beginning of the call, I said that cortisol isn't supposed to spike until like 6 or 7 a.m. Oftentimes when we go to bed and we have a lot of these things still ruminating because we've had a difficult day, we have a problem in our life that doesn't seem to have an answer. Caregivers, we struggle with these sorts of things. And what can happen is when you go to bed with too much on your mind, it can kind of pull that back to where the cortisol can actually release way too early. It can release like, 2 in the morning, 3 in the morning. And then, like I mentioned, the cortisol goes to your liver, the liver releases glucose, and you wake up with a sugar high. You can't go back to sleep if you have a sugar high. There's no way. So, this is one of those things where I would like to have a real session, because we could talk about, for example, the use of adaptogens, right? Like an ashwagandha, a rhodiola, something right before bed to help hopefully kind of postpone that cortisol release if that is the issue. There's something called PS, phosphatidylserine, that is a great ingredient for that as well. Things like kava are great because it operates on the GABA receptor, right? And having an influx of GABA can help. Yeah. So I would really recommend prior to bed having a pretty good little, parasympathetic routine to sort of transition you to that state. I also recommend utilizing things like the Oura Ring if you can, because it will give you an indicator as to what the heck is happening midnight, in the middle of it. Why are you waking up? Is your heart rate also elevated? These are indicators that it's more of a cortisol issue. Another thing is journaling. If you go to bed and you are thinking about all the stuff for the next day that has to be done, it can make it so that cortisol thing kicks on a couple hours after you fall asleep. But the physical act of writing it down, now you're not going to forget it. You know what needs to be done the next day. And as a caregiver, I'm willing to bet it's a big, long list, right? But write it down and just drop off the luggage, right? It's on paper now. You don't have to think about it anymore, and just grant yourself that release. I find that really helpful as well in my life. So those are a couple suggestions.
I'll tell you,
Dr.
that
Laura,
was beautifully comprehensive. And one thing that I will add to that is magnesium. Having, like magnesium glycinate or threonate, that really helps to relax the muscles, calm the nervous system. Take an Epsom salt bath, add in, some of your own essential oils, because I will tell you that stress will deplete magnesium faster than anything. So you need to make sure that you have those magnesium stores, back up, and that can help. Like I said, sometimes you do need a few Band-Aids or a few little, things to help, stop the bleeding, until you can really start working on the larger foundational issues. So
Yeah, Virginia offered in the chat that she's a hospice nurse and she's grateful for the tips. And so I thank you for the work that you do, because I think
yes.
death work is difficult, period, but not well supported or understood within North American society. I wonder, and powers that be, if you're listening, I think we should do a webinar that's specific to caregivers and how we can support caregivers. All right, let's continue on. Let's see if we can chug through our questions. Susan is asking, if someone had birth trauma and has always had an overactive stress response relative to other people, she feels that it's hardwired within her body. Can this be resolved? What are kind of ways that can help support this? So I would offer, Susan, I don't know if you know your genes. If you've run your DNA 360, this might be one of the points you might want to start with, because I think knowing how your body processes stress from more a neurotransmitter, a genetic level, will be really helpful, because then it can very much gauge some of the responses, help with selection alongside kind of the history and the story of birth trauma. But I would offer, before I toss this question out to Justin and Dr. Varden here, that absolutely, I think there'll be an element of acceptance, understanding how your body works and supporting that as it naturally does, but then also learning tools and techniques that are very, very specific to you, because no one needs to be stuck in this space. Yeah. Yeah.
I'll add to that as well, because we've got these different doorways into the body, and you mentioned breath work being somewhat effective, but not a be all end all. There's your body responds to things like breath, it responds to things like vibration, it responds to things like light. So, at the risk of turning this into a commercial, I will mention this Apollo Neuro thing, because that's among the primary things I use it for, is to help with rhythms and sleep and gear up when it's time to gear up and gear down when it's time to gear down. For example, I actually, believe it or not, have some level of social anxiety. I know it doesn't seem that way when I open my big mouth on these things, but I set this thing, it has a social setting, right? And it makes me like talkative. So on the webinars, just know that all the things I'm saying are totally artificially induced. And normally I would just be sitting here all quiet. But it has like a relaxed setting, it has a calm setting, it has a power nap setting. And I use this because it creates its own level of vibration that's kind of like music, but it's not audible. Your body feels the vibration, and it's like certain songs can get you all amped up like Dr. Krista does, or certain songs can get you kind of more calm and relaxed. It's the same thing, your body's responding to those frequencies. It's just with this device you don't actually hear it. So I like gadgets and stuff that can do the work for me sometimes, because I'm not a meditator either. And maybe look that up. Apollo Neuro is a great one. Dr. Laura mentioned other vagal nerve stimulators and things that I think can really help. So check those out.
Yeah. Yeah, it's a category called techceuticals, and it's an idea that not everything needs to be ingested or physically done. And Dr. Sapp has an Apollo as well, and she adores it.
Mhm.
Yeah. All right. Kathy has a question. And I think, Kathy, we've indirectly answered this, but I'll still acknowledge it. Because it's very much a caregiver question. I think we found a webinar that we need to be given, because Jihan is a caregiver. Kathy, you are. She goes to bed very early because she's exhausted, but then wakes up 5 hours later. There's our little cortisol, and can't always get back to sleep. She has an Aura ring and she averages about 6 restless hours a night. She's tried sleep aids, nothing seems to help. She's a caregiver with 2 grandchildren. Kathy, I think we'd also want to know where you are in your menstrual cycles, right? Have you finished that? If so, what sort of transition support, right? What supports do you have? I think there's a lot of little avenues that can be explored, right? There's a lot of reasons for that cortisol outside of maybe just hormones or maybe just caregiving. But I think it'd be helpful if we do a caregiver webinar, and then making sure you have a good practitioner, right, Kathy, that can evaluate all the different ways that are getting to this. Because I think we all agree here, we've said it a few times within this webinar, that shortened sleep needn't be a reality. We just have to figure out how to properly blunt that cortisol response. Yeah.
I want to address the fact that if you go down 2 more of those questions, Kathy kind of
Mm.
continues what she
Oh,
was
thank
saying.
you. Thank you.
And I have such heartfelt compassion for you that she's saying that she doesn't really want to do it anymore, but feels bad about not doing it, so she just doesn't say anything. And it's that back and forth of, I know I should be doing this, but I don't want to do this. And does it make me a bad person? And how do I love them and show them that I love them, but also take care of me? And she knows that it's got to change.
Mhm.
And this is where having that support system and saying, you don't have to do this all by yourself. And you don't have to, try to figure out the world on your own. So, yeah, I honestly think we do need to have a webinar specifically for caretakers, because there are a lot of things that can be done, support systems, and how do you go about doing that? I mean, in history, we used to live in closer knit communities, in larger extended families. We all helped one another. It's not like it is now where, and oftentimes it is put on, the mother figure or the female, that we're expected to do everything. And I'm only saying that because a lot of times it is the mother staying at home or having to do all of this. But Justin, I'll tell you what, I give you huge kudos for the work that you do. And, being a caregiver as you are, um, it is such an immense job, and it is so emotionally, mentally, physically taxing, um, and feeling that weight and sometimes frustration and not feeling like you can do it and sometimes not wanting that you can do it doesn't make you a bad person, doesn't make you love them any less. Okay, I want you to know that, because you also have to take care of you so that way you can keep taking care of them.
Yeah, it's like when you board a plane and they say that in the event of an emergency, right, you adjust your oxygen mask before you adjust your kid's oxygen mask. And they say the same thing about life jackets on a boat. Make sure yours is secure first.
Yeah.
Because if your kid is drowning, right, you have to make sure you don't drown, because if you drown, they're definitely going to drown. Right. So that this translates to the taking care of yourself. You have to be that person who's healthy enough to take care of others in your circumstance. So make sure that you're giving yourself that. Find a way, if there's a will, there's a way. So make sure that you do that, because you're very important as well.
Yeah. And I would imagine if you kind of stepped into that role too, offered into that, there was a moment where you wanted to and you saw the service. And so I don't know if it necessarily has to be a binary of do or do not. There's probably a happy middle ground where you get more support, right? But then continue should you so want to in that support role. Yeah. So thank you, Dr. Varden, for catching that Kathy had a follow-up comment. I really appreciate that, because I think you gave voice to something that a lot of people think about but don't necessarily say out loud. So Kathy and Lara, like, huge kudos for kind of saying something that most people would not say out loud. I think most people feel that way, but no one says it. So if I had a hat, I don't wear hats, but if I had one, I would tip it to you both. Yeah. All right. Um, Diane is saying, uh, so Diane's, I think, struggling with sleep, and she's saying she takes ashwagandha. I imagine this is in response to Justin kind of commenting that adaptogens might be helpful. And it does not seem to be working. I think, Diane, this is that beautiful working with a practitioner to find the appropriate thing that is working for you. Right. Oftentimes herbs might need to be given in combination. Oftentimes it's not just a thing of stress. There might be another variable. So I think working with a practitioner here would be really helpful for you, because if you're trying something that should change and it doesn't, that's information. That's great. And that can redirect. And often it's a practitioner that can support that redirecting. Yeah. All right. Zoya, I don't know if I'm saying that correct, has a question, but I'm not fully sure I understand. She's saying, why cold hands and feet. What I think possibly due to testosterone, Zoya. Maybe if you want to shoot us that question separately, I don't fully understand it, so I don't know how we can address it here. I think maybe it was just a typo on your part, but if you want to give us shoot us that separately, toss it into the chat privately. We can maybe get back to you on that one, because I think this here reaches the end of this wonderful little webinar. To those that held on to the very end, that were looking for some more in this conversation or support, thank you so very much. We value, and I think a lot of it is caregivers, right? Because that can be a source of high cortisol. And so we hear you, we see you, and we're going to ensure that we offer that offering. So to our caregivers, both of whom are panelists here tonight, who show up in life in beautiful ways, both for others and for self. Thank you. Thank you for the offering to others, especially this evening. Thank you for sharing your wisdom and knowledge. To everyone who also showed up, thank you. We're grateful to our community, Kathy, who said something that was difficult to say out loud and shifted the conversation. All y'all are wonderful. So thank you. I'm grateful for you as we shift into American, or as Canadians put it, alternative Thanksgiving. The other Thanksgiving. But that's okay. I hope everyone has a most wonderful Thanksgiving. I hope you enjoy the family and friends and whoever your community is that you show up for and enjoy time with. And don't die on Good Friday, because I hear that happens. Be careful out there, people. All right, we're going to dance out. Thanks, everyone.
Bye. Grateful for you.
Mm-hmm.